back with a celebrity doctor again, a very, very, very senior doctor. I was just telling sir before the show, apologizes, if I fumble somewhere because, I've never interviewed a very senior doctor like this. We have Dr. Pradeep V Mahajan. Sir is a general surgeon. Sir has completed his MBBS, done his general surgery, then has done his diploma in urology from Austria. He's an associate fellow of industrial health for the government of India, a diplomat from the American Board of Regenerative Medicine. Currently, Sir is practicing as an assistant professor of surgery in the Indiana School of Medicine, Indiana University, United States of America. Faculty and Director Fellowship course with the MUHS. Faculty of Examination with the DY Patil Medical College. He's a consultant surgeon and neurosurgeon at the Fortis Hospital, Seven Hills Hospital, Mathadi Hospital, researcher in regenerative medicine, technologies and faculty, and expert reviewer, international research journals. He's an ex-honorary associate professor in regenerative medicine at Dr. R.N. Cooper Hospital, an ex-associate professor in the Department of Surgery, Turner Medical College, Navi Mumbai. Other than this, talking about Sir, more than 25 publications in reputed journals, international and national, has collaborated with top universities you talk about in the world, not just in India. And, very kind, very humble that, he's, accepted to be a part of our show. But I think, we audiences are very fortunate today because an experience like this coming in front of us, and the topic that we've chosen today is delayed development. A lot of times, we go to the doctor, we take the child, and the doctor says that the child has a delayed development. A lot of times, parents do not understand what this delayed development means. Is this something got to do with the society? Is it something external? Is it something internal? Is it something happening inside the brain? Can we deal with this? Can we repair with this? I think we have Sir for the next 1 hour with us. So, Sir, to start off with, can you please explain our audiences, when do we say that there is a delayed development? What exactly is happening in the human system in a situation like this?
Wherein the best part of the knowledge is dynamic. What we think today is not true for tomorrow. Whatever the world today knows is a science which was researched 50 years before, because those are the textbooks, those are journals which published that time, came as a research over a period of time in a textbook to teach in the medical schools. So the access to the complicated structure of the brain was very difficult once upon a time. We did not have any kind of technologies like scans, molecular science, genomics, proteomics, talk of so many things which are coming up. We never had access. So we concluded all the science around.
I think there is a little glitch in the network. I'm hoping that Sir is going to join us back. I would request the audiences to please stay back. A very senior doctor, like I said. I'm sure the technical team is looking into what went wrong. Welcome back, sir. I think there was some technical glitch, but yes, the audiences are right here. We made sure that nobody leaves. And
extremely sorry, audience. I'm very sorry, or musicians, looking at little.
Sir, I'm very sorry, but there is still a technical glitch happening. Sir, there is a network issue happening because your video is not clear.
Hear me now, look. Can you hear me? Can you see me?
Yes, yes. Now better, better, sir, better.
There's a problem with the network. You be here. The idea is that today we are on a science that is dynamically moving ahead. We have access to the molecular science, genomic science, as well as the MRI technologies and PET scans. So we know the molecular working of the cell. Now, then it was very difficult, as I said you, but today we are on a very good platform where we know the entire mapping of the brain. The entire mapping of the brain shows the entire development. So we have access to know what is delayed development today. Delayed development is a concept in the entire genesis, or what you can call ontogenesis, genesis of the brain, when the brain is developing in the womb of mother. Many of our audience, many of the consultants, many of the doctors, researchers may not know today even which is the first cell develops in the embryo of the mother. We have development in the womb. So that makes me understand why neuron works into every cell of your body. You pluck a hair, you pluck a nail, you will have pain. It means the tag of neuronal connections to every part of the body, whatever develops later on. Now remember, this of development, extremely fundamental role in the development of the brain. Why I'm telling you is that delayed development is not an idea to say that it cannot be improved. It can very well be corrected. Today, we know when the neurons develop, that is the concept where the mother is gestating a baby. In the first 3 months, our brain has got 100 billion neurons. Can you imagine 100 billion neurons? And they are supposed to develop in 3 months of time. You imagine the speed of neuronal development. 3 months, 100 billion, and we have a limited time of 3 months, 100 days. Each day, 1 billion neuron. The speed of development. And remember, during this development of that speed happening, something goes 0.0% wrong in the microenvironment of the baby. And thereafter, again, something goes wrong in the mother's pregnancy of the second trimester in the form of the required firing of the neurons and shifting of the neurons from transferring the neurons from one location to other location of the brain to make the neo brain. We have a neo brain, which we are not a primitive animals like earlier animals where they are basic working on basic brain or base of the brain. Now this neuronal connection is by migration. During the second period, if mother suffers can lead to developmental problems of the brain. And fortunate enough, one should know, Varenji, brain and its neurons are constantly with the environment within the womb of mother, outside the environment which mother is facing, because mother is a guest, mother is a host to the baby now. And that baby developing is as good as an organ of the body of the mother. And in the last 3 trimesters, third trimester, where the connections are developing between various centers of the brain, like a speech area you can take, understanding area you can take, communication skills you can take, vision area you can take, thinking area you can take, memory area you can take. All these areas need to connect because brain functions in unison. It functions together, all the parts. In fact, now the third trimester, as I said you, if mother has some issues of preeclampsia, antibiotics, convulsing happens. At the time of the birth, when the baby is just born, if there is a problem by swallowing an amnion, swallowing enough amniotic fluid, as a vomiting, enteritis, bleed, trauma, hypoxic injury, take off a conditions of bleed in the brain, anything. And after the birth, up to 1 year, where the connections are very big. Febrile conversions,
So we are kind of
John.
losing your voice, sir. It's not clear.
Is it clear now?
Much
Hello?
better than the
Hello?
last 20 seconds, sir.
I'm sorry. I apologize to the audience. There is some network problem coming, but we'll see that. I'll see that the network remains consistently the way we want. Now, here in this case, this part of the life up to 2 years, child having any issue, where the connections of various centers are getting connected, the child has a maximum opportunity of delayed development of the brain. And this delayed development of the brain can reflect only after age for the reason. There's a very specific reason. Maybe the mother and father will never know it and will know when the milestones of baby will start. Milestones start in the form of mother when the child has to crawl, when the child has to turn around, when the child is going to eye contact with the child. Those milestones. These milestones are not found in animals, in human beings. So the beauty of life, because the calf to the cow is born, she gets up and walks. So there is no question of higher brain there. So delayed development is a concept which is seen only in human beings, and that too related to the higher functions. That is a new brain. So the idea is that in the history part, one has to, all the parents know, all the neonatologists should know, pediatricians know, all the consultants should know, relationship between the development and the brain development is related to milestones. Anything failure leads to a disaster to the parents. And you can find delayed developments, those are called, like you can call them autism, cerebral palsy, you can call delayed learner, global delay, you can call speech delay, understanding delay, ADHD, you talk anything of them. They fall small brother, elder brother, super elder brother, all are related to each other. That's the concept of delayed development. And here, one thing all the audience should remember, your all brain is constantly interacting with the environment outside. And the genes of the brain, neurons, are responding to the environment. So expression of various genes are relatively important for the delayed development. If the more the battered baby, more the problems of the baby. More the problems of the baby at the gestational period, at the time of birth, early delayed development. So it's
It's unfortunate. I think there were some very important concepts the doctor was explaining. So till sir comes back, just to summarize what he was talking about how the brain has 100 billion neurons, and the growth of these 100 billion neurons, the connections between them happen over a period of 100 days. So it's almost 1 billion neurons in a day, and all these neurons are connected to each other. And if you look into the total number of connections, it is more than the number of stars in your galaxy. I was just trying to explain them in your absence about how the neurons and their connections, are the number of them, the number in the galaxy. I was just trying to summarize what you were saying, sir, because there were some network glitches. Few important things from the last few minutes that sir spoke. I think 100 billion neurons, and all of this is happening at a gestational age. And like sir was constantly emphasizing about how the genes are constantly interacting with the environment, and at the same time, uh, understanding the delayed development happens at a particular age, which sir is going to talk about in the next few questions. Sir, how do we identify what should the parents be looking for when we are talking about delayed development?
The good advice for all the parents, there are two concepts. Having a baby with delayed development is a problem, right? The second problem, not having baby with today's lifestyle, is again a bigger problem. So I always tell the parents, please adopt the systems. If the natural system you follow, we can definitely identify our baby is not going to have a delayed development problem. One, during the gestational period of 9-month journey of the mother who takes the baby in her womb, remember that baby is as good as organ of the mother. So if something goes wrong to the mother should take priority health of her. What are the conditions given by their pediatrician doctors or consultants? They should follow the norms of keeping health upgrade with the healthy diet, because certain deficiencies diet can lead to, like B6 deficiency can lead to a problem, D deficiency can lead to a problem. All these vitamins, nutritions, which are supposed to be, because everything what mother is going to take is going to go baby. What blood she has got is going to go baby. If she suffers from the disease, is going to go baby. Everything is going to baby. If she has some antibodies, it is going to go baby. Everything is going to go to the baby. So remember, the health of the mother in every aspect, social aspect, mental status aspect, and physical health aspect are very important. Second most important part, having the right period of completion of pregnancy. If it is getting delayed or if it is little early delivery, having sections, having complications of the type of birth, so you have to have a clear opinion with your doctors, consultants. Give me the proper journey of my outcoming of my baby, proper journey. So the follow-up regularly with the scans, blood checkups, having a right opinion from your doctor about the requirement of LSCS or the birth of the baby requiring uncomplicated of some kind of section or some kind of episiotomy or something like the procedure of forceps, and after the birth. These are the parameters they should always take care of that. Having pre-prepared that everything goes a smooth journey, you can avoid these complications. And after the birth, I would always request parents, please nurture the baby for first 6-8 months on their milk, not the which you go for basic cause of delayed development.
Right.
See that they go on a proper nutrition so that they don't suffer from any kind of enteritis. If they have icterus, take a follow proper, because icterus is known to have a chemical encephalitis of the brain again a cause of delayed development. Subconsciously these things happen, and all of them, my baby was healthy, nothing has happened, but nobody looks in this fact. So all these factors they consider properly, then I think most of the babies who are likely to go into delayed development or delayed complication of the brain or early complication of the brain or developmental problem of the brain or hypoxic complication of the brain can be very well early detected. History and proper follow-up. Immunization should be right. Health assessed factors should be right. Parameters of milestones should be right. Don't just think, no, thoda देर बात कर लिया. No, please take care of that. That may having autism, that may having particularly what you can say vocalization is delayed. These all things could be relatively understood by the parents and then should be followed up regularly. I think that can be avoidable, as I said, you all the parameters, the access to it properly.
Sir, like you mentioned, you spoke about an ideal age where we can actually see the delayed developments. But what is the earliest age, if you have to say so many days baby or so many months baby, what do you think is the earliest age where we can identify?
There are
And what
two.
are the assessment tools, if there are any?
Yes, Dr. Valenci, there are two parts. Remember always, keep a line horizontal, give a vertical split to it 9 months before, 20 years later on. This is called as a critical periods, sensitive periods. They are called sensitive periods. These sensitive periods are to be properly monitored by various scans. The sonography or ultrasound, which is a very primitive as was investigation today because it is very commonly done. It is not a very advanced investigation. It is accessible to every parent, every doctor. So seeing the baby growth, fluid, development of the various parts of the brain, size of the brain, relatively having the skull sizes, body sizes, parameters, if they are going normal, probably chances are less. Second, at the time of birth, if you have to keep the parents understanding, they have to watch what are the causes, as I told you. Just avoid those causes for the diagnostic purpose also to understand whether the baby will be going into a problem or not. And the
Right.
post, what you can know, learn about the icterus, loose motions, fevers, earliest. Which are the parameters, again, to have a clinical side to understand baby can avoid the going into delayed development or not. And after the 1.5 years age, always see the milestones properly. Those milestones, if they are getting delayed, please go to your consultant. Insist the causes, what I told you. Look into possible those causes to rule out. So I think these are the parameters I would suggest as a diagnostic to understand before and after. After, up to 1.5 year, because many of the milestones don't reflect so effective for the parent to understand child has delayed or not. But
Right.
if the child is never not responding to the voice, child is not responding with the eye movements, you just look into that and then go to your consultant and keep a follow-up. This will give a lot of filter understanding of the parents earliest to know child will have a delayed development or if there are some issues which I told you, you have a direct access to your consultant, direct investigations, and find out whether milestones are matching. That was, I would say, the before and after, earliest to know whether chances of having delayed milestone are not. This would be parameter. And investigation-wise, depending on that, you can go for PET scan, MRIs. If there are hypoxic injuries, MRI earliest will show there are periventricular lesions of leukomalacia. You may find some of the lesions of patches of small bleeds here and there if there are something. You may find some evidence of some kind of abnormal EEG neurofeedbacks, which could be subconsciously. You may consider, no, there are mild jerks. No, you get into neurofeedback EEG. Definitely, you will come to some conclusion. So these are the parameters I hope you should, as an investigation, earliest to find out.
Thank you so much, sir, for that very insightful explanation. Sir, another doubt that I get now when you were talking about genes and genetics, uh, now in the newer books, we even read about a concept called epigenetics. So, can you please explain our audiences what genetics are and what epigenetics are, and is there a role of reversal, with genetics or epigenetics?
Dr. Renji, you have asked a very, very powerful question. I would say very powerful for the reason life is epigenetically changing. Brain is under an epigenetic scanning always. You remember I told you a word like scanning. Epigenetics is the environment, your lifestyle, the way you take the life, your exposure to the external factors, and second, your exposure to the internal factors. These are the factors, internal and external factors, which affect to your body's genome are called epigenetic factors. And these epigenetic factors will bring in two type of mutational changes in the genes. One, polymorphism. Second, pathological mutations or having abnormal cells, which leads to these kind of epigenetic effect on the brain development. In my opinion, always I talk, the interaction of the genes on the neuron to the external and internal factors are responsible for the child. Even today, I would say rather, this environment of the epigenetic on the brain, response of the gene to the epigenetic factor, even you can detect all those Alzheimer, all those are possible to have a possibility of epigenetics and the neurons have a strong relation, very strong relation from the womb when you are born and after the birth. So epigenetic plays a major role, and fortunately, Virenchini, it is my favorite subject. I
Sir, you've been a part of many NGOs. You've been uh, an examiner, a faculty. Uh, you've gone to universities. You're collaborating with them. Uh, I'm sure you must be having so many of your favorite cases in this vast experience. But would you like to share one experience about dealing with someone with delayed milestones and how you'll have approached the whole situation?
two situations I can quote for which
Please.
all the audience will be very happy. So first of all, I want to give a very good news for all audience. Trust me, don't give up for delayed development of your child. For any reason, take it any reason, whether it's a genetic, you take a Down syndrome, you take a Joubert syndrome, you take a SWS syndrome, any syndrome with genetic presentation. You take any effect of developmental problem in the brain. Today's science says neuroplasticity is the biggest achievement today what we have learned. In a standard medical teaching, I was taught neurons, you are born with the fixed neurons, number of neurons, and thereafter no neurons can grow. On the contrary, with the brain atrophy, neurons reduce. This is called the myth today. This is a changing dogma of medicine. If you come to my lab, I'll show you firing neurons in the lab. We can develop neurons in the lab. You can transplant neurons in the brain. You can change the neural behavior. You can change from a motor neuron to sensory neuron. All this is possible today. So I have got two examples to say you here. One, I have a privilege and feeling as a proud physician and researcher in stem cell technologies or Regenerative. I have treated the world's youngest child of 11 months with severe convulsive or defect in the brain with cerebral palsy, with a spastic nature. Every hospital had given up hope rather. Every hospital has given up hope. They said, nothing can be done. Just you have to be like that. No medicine was working for even controlling the convulsions. And trust me, 3 months and the life is changed for the baby. Complete life change. Today, this baby is growing normal. No convulsions. Going with the milestones of the birth. Maybe not that intelligent like a normal child, but ADLs are achieved. Cope up with the regular school. What else you want from this kind of example? Now, the second child which I treated, I'm telling you a newborn one, and the other one, which I feel proud again to say, one of the delayed learning child who came to me at the age of 14 years. Now, this was a newborn. I'm giving an example to you, who was unable to cope up even the smallest questions in the school. He was being pushed always to here and there to get into curriculum. And I'm proud to say you, this boy, after neuroplastic treatment and neuromodulation, scored 87% in 10th standard. What is
Wow.
happiness I want? The two examples I can quote at my experience from the book. One, the earliest possible. Second, the most possible, where people feel he is now 17, 18 years, nothing can be done. Trust parents. Neuroplasticity in your brain is till you die. You can have a learning potential of increasing your synaptic connections. Even at the age of 40, 50 even, you can develop those synaptic connections. But it's a matter of going the proper protocol designing and inducing within the brain, meet you and the external source can induce VCL cells into neurogenic potential and use neuropeptides, neural growth factors, and the microenvironment current and mitochondrial function. I think there's a chance which everybody should take. There is no easy job to say there is no access to the brain. On the contrary, Varenchi, I'll tell you, brain is the only organ in the body which has a functional one cell, that is a neuron. The glial group of cells are supportive neurons, supportive cells. You take off skin, there are functional 4 types of cells, vitals. You take kidney, 17 types of cells are there. Take a hepatocyte, there are 4 or 5 types of cells are there. Take a pancreas, 4 or 5 types of cells are there. These organs you are talking of repairing. And where it is not functional one cell, you are believing that it cannot be repaired. So I believe more easy is the brain repairing than any other organ. So trust. These examples which I have given the earlier stage and the latter age feels me proud that I could change the life of 2 children at the 2 ends. In between, there are thousands of children of different category. Since you asked me what are the 2 examples you can tell me which impacted my life. They might have changed the life of the children, but impacted my life even. That is the beautiful history of my practice and research.
Well, I think you have instilled a lot of hope to all the audiences, and even in future, whoever is going to watch this video, I'm sure people are going to understand that there are treatments available. Because, like you said, Doctor, a lot of people give up when the situation is like this. But at the same time, since you've spoken about these kind of interventions that are available, how important is it to intervene early?
Good, Virenji. This has a very effective role in the development. Earliest, the better always. I'll give a very beautiful reason. Many of them don't know. They start an educational system which have been modernly designed to start at 5 years and 6 years of age. I don't believe in this kind of system for the reason the synaptic connections of the brain, that's a Perning effect it is called as, are maximum up to 1 year. From birth to 1 year. There are trillions of synaptic connections. And these synaptic connections are the process of learning to grasp 2 types of synaptic connections. One, temporary. Second, permanent. Now, temporary connections, if you want to make permanent, then you have to start earliest.
Right.
Earliest. Now, making a new synaptic connections later age, it is possible, but it's little difficult to get the results. So it takes a time there. It takes a time because earlier we develop a temporary connections, then we have to push on with trainings, programs, with modulation of neural modulation to make them permanent so that these connections remain consistent.
Right.
So I believe earliest is the best. I give a perfect reason. Even if you give a child training at the age, small trainings, at the age of around 1 year, when he starts to understand the environment, his pickup is so fast, you don't need to train them. They learn the languages. You can go to the family who has been transferring again every 6 months, 1 year from one place to other state, and the language are changing. Multilinguistic child, automatically he will become. He don't have to go to schools to learn 4 languages then. By birth, he'll be multilinguistic. So that's the beauty of understanding the development of the baby. And if you go after training, schooling after 5 years, 6 years, remember, the child requires a boosting, boosting, boosting. The reason is that neurons together fire, neurons together disappear. Either you fire, either you disappear. So if you maintain the firing from the beginning, they become permanent. The learning process becomes very, very easy. So that's the
Right.
reason.
Sorry, sir. I think we are losing your network a bit.
I said, very difficult subject I'm making very, very easy. Making to understand is a common
Absolutely.
language, scientific language.
No, no, absolutely, absolutely. We're very thankful for that, sir, because yes, like you said, even for us doctors, these concepts of neurons, neuroplasticity, epigenetics, neurogenesis, these are difficult concepts, but the way you are explaining it, it's so simplified. Thank you so much for this, sir.
Pleasure.
So my next question is, since we all believe one size does not fit everyone, how do you tailor your approaches for different children? What parameters or what dimensions of their life do you look at when you're tailoring a treatment?
Oh, wonderful. We are going in a generalized medicine to personalized medicine. Now, the question leads to be a personalized medicine. What a standard pharmacopoeia teaches is generalized medicine. If you have convulsion, give this tablet to all of them together. If you have depression, give this tablet to all of together. You have maybe minor selections, but combinations and giving that, right? To take care of those symptoms. But what I'm going to talk to you today, not a generalized treatment. I'm going to talk in precision medicine. I have a very perfect protocol design. How to customize, make it personalize, customize, personalize, and precision is the last word I'll take you. First of all, customization. Customization means everybody's development, genetic expressions, and biochemical functions, as well as immunological functions, are different. Everybody's microbiome of the intestine is different, cannot be the same microbiome to everyone. Understand now, I'm given two parts. Third part, everybody doesn't match the same development. And fourth, everybody doesn't have the same repairing capacity. So these parameters we have to consider when we tailor completely treatment protocol to personalize. So symptomatology, various scans, historical historical events of the mother and the child, leading at the stage where the child shows the developmental delay, the causes to relate that developmental delay. All these findings we put together on our research platform questionnaire, which gives me outcome. What is going to be outcome of the treatment for this? And what are the things I'll require for them? What are the protocols to be designed from energy medicine, from a perspective of various growth factors, perspective of various neuropeptides, perspective of mitochondrial function, perspective of genetic expression, perspective of dynamics of child behavior, perspective of gap between the two birth and the symptoms where the parents have recognized, the physician has recognized, how severe those symptoms are there. Then comes the mapping of brain. Mapping of the brain is a beautiful idea in any kind of management when we decide the tailoring of the treatment. Mapping of the brain takes you to the journey. Which part of the brain is showing abnormal EEG responses? Various scans will show which part of the brain has got metabolic defects. Which part of the brain shows there is an hypometabolism or hypermetabolism? Which part of the brain shows leukemic lesions? Which part of the brain showing scars? birth injuries, bleeds. That leads to an entire concept. Today, the brain is so easy to understand. We have access to understand A works for B symptom, C works for M symptom. So we know which part of the brain affected, what are the symptoms. Now I have mapped the brain, making more easier now. Once I
Right.
have mapped the brain, my job is very simple to customize and personalize the treatment now. I know what is required of the parameters and
Right.
precision to the target treatment. Target treatment means symptom. I have a child today. Today I'm talking of today.
Right.
Since birth, 10 years of age, he was not vocalized. He don't know even crying. There's no voice. He has lived his life on sign language. Everything on sign language. Believe me, today's 15th day, he started oh, ah, and crying. Oh, ah, and crying. It's a very personalized treatment. Looking into now, what I have looked, I'll give a very example beautifully here. What I looked, the Wernicke's area, Broca's area, connections between both them, then in what you can say volumetric MRI, functional MRI, showing PET scan showed me the defects, the area. Then we did scopies of the oral or voice, endoscopies, laryngeal scopy, tongue movement, supporting movement of the muscles, which can help to the making voice, lip, gums, tongue. All is important. Where is the location where the matching, where we are missing the tag? Precision medicine. 15 days, child started. And I have a very confident, another 3 months, 4 months, he will call mama, papa, and then come to comprehension, creation,
Right.
bringing in the sentences now. So this is how the parameters we use. We go scanning, particularly very precise. There are questionnaires,
Right.
there are diagnostic tests, there are evaluations, then put together in a sum up question and get the solution. I believe I made it very simple.
Absolutely, absolutely, sir. Absolutely. So how difficult is it to actually, break this news to the parents when you know that the child is having a developmental, delay? And how do they receive it? And what kind of emotional support should we be offering to them at such times? Because even in a smallest diagnosis like diabetes, it panics an adult, but here it's the most precious thing to the parent, that's the child. So how do
Yeah,
we
very
deal
good.
with such situations? So I'm sorry, I think we are actually we couldn't hear what you said for the first.
I say, child, the developmental problem is a big problem to the parents. Not having a child is a
Right.
bigger problem. Infertility again is a bigger problem. Now,
Correct.
every parent has an asset as a child for both of them, which they pass on. Their hierarchy, their genomic character, their life earnings, and their future everything to the child. And if they find there's a big challenge, there's a big nervous breakdown in the couples. Very big nervous breakdown. But your approach to the science should be very powerful. And assurance to them, there's nothing impossible. Science is changing. Today we are in a period, dynamics. Today what I spoke today may be different tomorrow. Because I'll have new theory to develop it again. New access to molecule, new access to gene expression will change. So a good news to the parents is, please don't get disheartened. Even anyone in the world says your child will remain like that. That is a history of 20 years before. Today,
Right.
I give a full confidence to them.
Right.
Have some patience, understand the challenges, and accept the changing mind situations, changing science situations. I give them the wonderful examples of this kind. I show them a living diagrams, living programs, living researches to build up the confidence.
Right.
Sometimes it becomes a very challenging job. But
Absolutely.
at some corner, there are no options. At some corner, there are no options. So most of them adopt it. And I have a promise to all the parents. Wait 3 weeks, you have wait for 5 years, you have waited for 3 years, you have waited for 2 years, wait for 3 years. They of happiness.
Right. Right.
I hope we
So
can
this
again
this
back.
this gives me
The life is full of happiness.
right.
The life is
Right.
full of happiness then again. The smallest change seeing in the child. Do you know the mother who
Right.
was with me? She started tearing in the eyes of happiness. She did not believe my child can cry. She could not believe it. So these are the very challenging situations come in the life for these parents. But you should be a right person to give the right guideline and give the
True.
right
So
hope.
true. So this gives me two more questions now. One, like sometime back, you were talking about two successful cases. Uh, you spoke about the interventions that we do to understand the situation. But what are the kind of interventions that are needed, and when do you time it to track the progress of the uh, child's development?
Yes, this is a very beautiful designing of the protocol system. Very beautiful designing of the protocol system. Once we map the brain, we know everything what's happening. We know every kind of this brain. We have to keep in mind mitochondrial dysfunction is the most important. Second, neural firing is most important. Third, oxygen very important. Fourth, nerve growth factors are very important. Neural peptides are very important.
Right.
And energy medicine, which today nobody believes, but I am a very fan of energy medicine. Very fan of energy medicine. The reason is that no medicine will work if the mitochondrial function is poor.
Right.
If my neuron is not firing, no medicine will work. And
Right.
we are talking of medicines to give them without having basic corrections.
Right.
Even if my biochemical reaction has to take place in the cell, I require energy. If my energy is not there, mitochondria is not producing required ATPase, and firing is not there, which biochemical reaction is going to take place?
Right.
So I prioritize the treatment with defining the protocols of these kind. Repair the mitochondrial function, remove the neuroinflammation, work upon providing the right concentration of oxygen, give the right neural growth factors, right neuropeptides play a major role because our all proteins of the neurons are made up of ATGCUV proteins, amino acids. These amino acids are the most that is producing is ATGCUV. So I
Right.
start providing these kind of neuropeptides along with these combinations. And all together, if it happens together as an integrated management, some of the doctors, some of the parents say, Doc, we have given hyperbaric oxygen for 3 months, nothing has happened. Why do you expect to happen? Any reason? But that is not the only defect. There are
Correct.
multiple level of reactions are involved. If you support each reaction followed by other, my protocols are designed on this philosophy. And I assure you, if you follow the precision medicine with molecular science, I assure you the results are standing in front of you. So I work upon these kind of technologies, working together. As I spoke you, various technologies, various molecules, but none of them chemical.
Right. Well, I think that's very beautifully explained, sir. So you spoke about technology, the developments. You yourself are a researcher. I mean, a, a very busy practitioner with so much of experience and so much of research that you have done. I think this is a very rare combination, even for the best of the best doctors, because people choose either of the sides, but it's so difficult to sail on both the things. What do you say about the recent developments that's happening in this particular field of science?
Very good for the medical practitioners, I would say rather. Dr. Virenchi, there's a good concept. Your mind and your thinking process has to be like a fluid, like a rock stone. If you believe your fluid mind, a physician is a very good person who knows the clinical side to become a good researcher.
Right.
Basic researcher doesn't have access to the clinical side. So he doesn't know how to apply his research. But you as a physician, you have to take a role of researcher, and very much possible. I told you, you have to have fluid in the mind, not a rock stone. If you have a rock stone, you are rocked to the end. You cannot change because the world is changing, dynamics are changing, medicine is changing, research is changing, astronomy is changing, molecules are changing, everything is changing. How the rock can define the answers? So if you are a fluid, you can enter in every accessibility easily, find a way, find a way, find a way
Right.
to become a good researcher. A good researcher can, a good physician can become a very strong researcher and apply it together. That's what made me a good researcher, because I knew during my 30 years of career where I'm failing in giving the results. The question raises in the mind, there are certain missing tags. Certain missing lines are there. Some missing words are there. To pronounce a right word, one alphabet is missing. So don't expect result. So till you find out what is that missing, for that you have to become a researcher. Go to the molecular level. You will get every answer what has gone wrong. So we talk not killing the cells. We talk repairing the systems. So that's what the approach makes me making very difficult situations, very easy situations. Very difficult cases, very easy cases. Somebody may say it's not possible, but for me, it is possible. Always possible.
I think great. I think because something motivating like this actually helps a lot of youngsters like me to go into the field of research. So thank you so much, sir. I feel like this question was very personalized only to me, and I've asked and you've given the answer. So it's come as a
Thank you.
blessing to me. Thank you, sir. Sir, another doubt that I had was now when we are talking about diagnosing a child, as early as 1.5, 2 years, and now while this child is undergoing treatment, there are different phases in that child's life where, till 3 or 4, the child is only in the family environment, but after 4, uh, we expect the child to go into an environment where there is schooling, where their child is meeting different people. Or should we be encouraging the child to do so? And if we are doing that, support will be given.
200%, you are a right platform. As I told you, up to 1 year, 1.5 year, the synaptic corrections are trillions and trillions and trillions. You cannot count. That number of synaptic connections are there. The child going into an homely environment and social environment out is very, very important. I would say rather to encourage all the parents, see the child earliest to go into social environment, learning processes, so that the future of the child is already grasped into permanent synaptic connections. Permanent synaptic connections. I'm giving a science behind it. Why? I'm giving you also what can happen, outcomes. So believe this is very important. Even if a delayed development is there, even if there is a delayed development, exposure to the epigenetic factors, which can change the genetic expressions because they're constantly interacting. Without treatment, few of the changes still you can see in the child. Without treatment, the few of the changes still you can see in the child. That's the beauty of the treatment, of managing the earliest treatment. Why you should expose the child at the earliest to the social environment and the family environment. And the family environment should be in a way where child knows to understand every dialogue, every environment of happiness, never to have a disharmonies in front, because he's grasping. He
Right.
knows, he understands. He may not express you, but he builds up a story in the brain. He builds up a story. He may not tell you, but he builds up a story. That story is a very dangerous story in the child mind, which will be taking a kind of philosophy which you later on also cannot change, because they become permanent bad memories in the child brain.
Right.
So these are the factors are very important in the family level as well as outside level.
Right. Sir, as a psychiatrist, I wanted to ask this question. What is the role of psychological and emotional support, both for the parents and for the child? Does it help, in the development?
Wherein I was sometime called in the Association of National Conference of Psychiatrists in Chandigarh as well as Bikaner to deliver a talk on brain development. I was so much excited. I was so much, because I am not a psychiatrist. I was not a neurologist. I was a basic researcher with a medical background. Actually, by training, I was a urologist. Practiced for 25, 30 years. So my relationship was not that deep, but my research was very deep.
Right.
So it was very easy for me to understand. It was very easy to understand.
Right.
So it could lead me to get a proper answer for this. So as a psychiatrist, remember, all these parameters what I spoke does matter to change the child's brain or even elderly psychiatric patient.
Sorry, sir. I
Are we
think we
stuck?
lost you for a few seconds.
Anything missed out? You're not.
Yes, yes. We could, sir. We could, sir. Uh, Sir, I mean, I know the clock's ticking. I don't want to take much of your time. The last few minutes, I actually would want you to, tell us what would you advise. There are going to be so many parents watching this, so many doctors watching this. Every doctor for sure meets someone with a delayed development in their practice, and parents know somebody or the other in the family or in their neighbors who have a delayed development. So what would you like to advise to all of them, sir?
The wonderful message which I would give to all the professionals and the parents, or in between, even the trainers in between, neuromodulators or rehab program doctors or rehab doctors who are working on neuromodulation or neurotherapies. Be connected with today, not with the past, what you have learned. First principle. Be connected today, not what you have learned in the school. That was a foundation. Understand the subject. That's the foundation to understand the subject.
True, sir.
So remain connected today. Where is the medicine going? Where are the molecular sciences are going? Where the genomic science is going? And try to upgrade ourselves. This is the first principle for all my colleagues, friends, and physicians and professionals. And for the rehab program doctors, they should understand the concept of all neurons fire together, disappear together. This concept, if they understand, they can work on neuromodulation perfectly to keep neurons firing. And third part, to the parents, I will request them, please don't feel disappointed in the life. Your childs are precious. They are your dreams. They are your lives. And you have all hopes on them. So give them the opportunity to look into a new opening of environment of life where science is dynamic. Take a new frame of life, change the mindsets, and believe all your children can become normal. This is a wise advice I can give all three communities which are sitting in front of me probably today.
Thank you, sir. Thank you. Thank you so much. Firstly, like I said in the beginning, thank you so much for coming into my show today, and adding more beauty to this show. Uh, it's really been an enlightening session. Concepts of brain, neurology, neurons, neuronal firing, neurotransmissions. These are very difficult, and the way you have actually simplified it, I am actually going to share this video to a lot of neurology and psychiatry residents who are doing their PG. So, some topics which they're keeping aside, I'm sure, they're going to get a lot of strength. You might get a lot of mails who are going to disturb you, asking you about some more concepts, sir. And, I genuinely would want to come down and visit your lab once. But thank you so much once again. And thank you so much, audiences, for staying throughout. I know there were some technical glitches, but yes, I promise to request, and bring back Dr. Pradeep V Mahajan, sir. Hopefully very soon on another show with another interesting topic. Until then, please keep watching. Please like, share, and subscribe to our channel. Share this video to a lot of parents, the WhatsApp groups where you all are associated, where there are parents, because a lot of people might not know about these concepts, but we are very fortunate today that we have a very senior doctor like Dr. Pradeep V Mahajan, sir, who's come down today. Thank you so much, sir. And, we pray that you come back soon again and enlighten us with another show.
Thank you, Dr. Virenchi, and your work station. Let me be very much grateful to you to get me on the platform and reach to the necessary people, reach to the needy people, physicians, doctors, therapies, parents who are stuck up with the bottleneck. What to do is a bottleneck. And I have opened that bottleneck for them to get a big opening of life. And I'm really thankful for you getting me here for this.
Thank you. Thank you so much, sir. So audiences, hope to see you all back soon again in the weekend with a new show. Until then, signing off, Dr. Virenchi Sharma, your favorite host. Thank you. Thank you, sir.
Pleasure. Thank you.